Thank you for being with us today. Today we're going to be discussing a topic that's probably the most common topic in our office, and that's low back pain and also sciatica, which is most commonly a result of issues in the low back. So we're going to go through, we're going to talk with Dr. Jake here and myself, and we're going to discuss this and give some ideas, some tips, and some ideas to help people deal with this in a better fashion and get their lives better. So,
yeah, Dr. Joss, I think that we need to think about, like, a lot of people don't realize in our community today that chiropractics can help with sciatic pain, and still a lot of people don't associate chiropractics with low back pain. They'll just go right to the orthopedic surgeon or their medical provider, and they get under the scope, I guess you could say, the scalpel, and get operated on instead. And so I think it's important to know that we do have success with treating sciatic pain, shooting pain down the back of the legs, both legs, or one side. And I think low back pain is the beginner. That's often the start of pain. When people just live through low back pain time and time again, especially construction workers, they're always lifting and beating up on their body. But then it kind of reverts into sciatic pain if they don't take care of the low back pain first.
Yeah, the most common reasons for the sciatica is somebody that has specifically a lifting injury where they are bending forward and their spinal bones, as these show here, create an issue where the disc in between the bones, the disc actually comes out and it puts pressure on the nerve. Disc movement out of the center of the vertebrae to the outside towards the nerve is what compresses that, what's called the sciatic nerve. And that is occurring in the low back. That low back vertebrae and disc is now putting pressure on that nerve, and that is what's creating the pain in the leg. So a lot of people think, oh, my leg hurts, the problem is the leg, but no, it's actually in the low back. So we have to be careful in our assessment, in finding out what the true cause of that is. So the sciatica can vary anywhere from very mild occasional pain in the leg to, oh my gosh, I can't move, I can't get up. If somebody can get through our door and we can get them in here, then we can typically get that pain under control. So that's the most common cause of that, and we see that in a lot of the professions that are around us. People who do a lot of lifting, construction, nurses, CNAs, those types of professions, we see a lot of this type of issue. So that's the most common reason we see sciatica.
Sciatica as well, Dr. Josh, is one that a lot of people don't realize. It's, like you mentioned, coming from the low back, but there's the variations, like you mentioned. There's burning, pins and needles, numbness, and there's stages of sciatica. If it's just barely being pinched by the disc, it can be disc issues. A lot of people, not everyone that comes in has a disc problem that causes sciatic pain. It can just be a subluxation, right? A twisting of the spine that can cause that pinching of that nerve and cause sciatic pain. Either way, your body has an amazing ability to heal itself. And that's what we do. We help your body, we aid your body heal itself and get that reabsorbed and heal that tissue, whether it's a disc issue or whether it's tissues that are injured from a lifting injury or whatnot. It doesn't matter. Your body can heal itself.
Determine what the cause was of those different issues. We want to do the right thing as far as helping them get back to their normal life as quickly as possible. So what we'll talk about now is what are the specific types of treatment we can do to help this, as Dr. Jake said, fix the different causes of the problem. So the things we offer in the office here vary anywhere from the chiropractic adjustment, which is the primary thing to help restore function to the spine, to some forms of traction, and we can also help reduce the pain and inflammation involved with that through acupuncture and through some stretching exercises and nutritional supplementation. So Those are the things that we can use to help get people back to their daily life and try to give them as little downtime as possible.
I think, Dr. Josh, that and the cool thing about our office is that we're really hone in on what works for each individual person, and we're not just the cookie cutter. Okay, let's crack you and move on your way. We're going to find what your problem is and what your body reacts the best to, whether that be acupuncture, whether that be KT tape or athletic tape, or whether that be a different type of an adjustment that your body reacts well to. We're going to push into that, or if it reacts negatively, we're going to definitely find a different avenue that we can get you feeling better the quickest that we can. Thank you guys for coming and watching our wonderful video today, and hopefully it was informative to you. Also remember, don't forget to like us on Facebook, Instagram, follow our YouTube channel. Woo!